This is Voices of CX Podcast Season 5. Recently, the speed of change feels like it's stuck on fast forward, and no one knows what's going to happen next. So we've made it our job to keep you up to speed and help you bring out the very best of your business by discussing the latest ideas with industry professionals, top research institutions, and influential thought leaders. Voices of Customer Experience podcast is brought to you by Worthix, a survey platform that self-adapts according to the changes of the market and the world. Discover your worth at worthix.com. Brian Carlson joined Vanderbilt in 2007 as an administrator of the Vanderbilt Eye Institute and now serves as Vice President of Patient Experience for Vanderbilt University Medical Center. He is responsible for institutional performance on service programming and metrics. Operationally, he has direct oversight to guest services, patient relations, service consulting, physician liaison, and Center for EMS Excellence. Strategically, he advises on institutional goals, employee engagement, culture, and patient engagement programs. Prior to Vanderbilt, he served as CEO, COO of a multi-specialty physicians group practice in Western New York and started his professional career at Northwestern Medical Faculty Foundation in Chicago. Today, I am joined by Brian Carlson, who works at the Vanderbilt University Medical Center, and he is here today to talk about patient experience. Hey, Brian.
Hello, how are you?
Thanks so much for coming on today. I'm really excited about doing this, and I know that PX is such a big topic, and we get so many requests to create more content on it, so you being here is really providential for our listeners.
Oh, that's great. Well, it's an honor to be here, and thank you for having me.
Well, I wanted to start off by, kind of explaining the clear differences between customer experience in general as we see it and patient experience, PX. So the difference between CX and PX. Can you give us a little rundown?
Yeah, from my perspective.
Yeah.
So at a base level, it's experience. And the way I think about experience, it's any and all interactions that we have with a system, with an organization, with a person, and it's highly unique to us, right? So, that's similar between the consumer and the patient space. What's also similar between the consumer and this patient space is that there's various different avenues that we interact with those systems. But what's different is on the patient experience side, so much of it and success in it relies still upon the human interaction, that people have a problem and they want to feel like they're being taken care of.
Yes.
And it's listening, it's communication, it's empathy, it's compassion, it's all of those things. And that's not to say it's not in the consumer space, because certainly it is, but it's so much more part of healthcare. That's who we are. That's what we deliver. So that's the way I think of a difference between the patient and the consumer space.
It's interesting because I would say that one of the strongest issues that must arise for you who deals in this industry is how delicate it is, as opposed to in customer experience where people are just doing regular transactions on a day-to-day basis. In this case, you could have people that are just going in for checkups, et cetera. But in many cases, it's people's health, it's people's lives.
Yeah.
So you have not only, anxiety and nervousness and fear, but there's so many strong emotions that kind of surround this experience, right?
Absolutely. Any conversation experience, you have to, in the patient space, you have to acknowledge the incredible work of the physicians, the nurses, the direct care providers that do it day in and out. But it takes a true team to do it. And that's where it gets complex, because the point of entry is so varied in how a person will enter the healthcare system. And we have to meet them where they are. And some people are healthy and well, and they, are willing to wait and maybe patient. There's others that don't feel well and they want to get in as soon as they can and know what's going on. There's others who have a chronic condition that they have to unfortunately live with, and their needs are very different. So the challenge is when we start kind of trying to map out and understand these experience journeys is it's highly unique and highly personalized. And that's what makes me really proud here at Vanderbilt. One of the things that we're focusing on pretty heavily is this term defining personalized care, and what is that? And it's a hard definition because it's personalized, and personalized means it's unique to me, and what's unique to me is maybe not unique to you or what you care about.
Yeah, absolutely. And as you were saying that, my mind was kind of thinking here where you were talking about different points of entry. So, when you have people that have emergency care, for example, and what you have to do is, stabilize them, make sure they're okay, in some cases even save their lives, right?
Mm-hmm.
But when you're talking about people with chronic illnesses or long-term treatment,
Mm-hmm.
there's almost a loyalty factor. Like, I don't want to be disrespectful because it sounds so weird when we're talking about people's health and people's lives,
Yeah.
But you almost have to look at it in terms of loyalty, right? To have those people keep choosing you
Yeah.
over and over again, right?
Absolutely. Yeah. And even on that scale, there's a difference because there's chronic conditions that you can improve on and make strides to. And there, your experience could be dictated by the skill and the expertise. Are people listening to you? Do you feel like you're advancing? There's other ones where it's maintenance. And you're a frequent flyer, so you see us a lot, but you could maybe go anywhere to get it taken care of and or be seen. So your threshold could be lower in terms of deciding, you know what, I'm gonna look somewhere else for taking care of this. And then there's a whole other avenue that gets into the world of second opinions in the healthcare space. And that's kind of a shopping. I heard this over here, and now I want to go over here.
Yeah.
And that's where brand strength really comes into play, and the strength of not only the brand, but that brand is grounded in the expertise and the excellence of the providers that work at that system and their ability to deliver on that care.
Yeah. So that kind of boils down to trust, doesn't it?
It does. Absolutely. Yeah.
So the trust that patients have in the healthcare providers and the whole system, actually, right?
Yeah, absolutely. So it's interesting. Yesterday, I had a colleague tell me, they are in the market for a new primary care physician. They've been kind of shopping, and access can be limited in primary care depending on locale where you live. And here in Nashville, we have some of those issues that, there's more people than there are primary care in some cases. So they had been shopping around, and I asked them, well, what's important to them? And they said, well, it's interesting because that's changed for me over the course of time. That now, what I want to know that I'm going to have the same person, because they had an experience where it was changing a lot in the past, and that I can get in when I need to get in. But most importantly, do I like them? Do I trust them?
Yeah.
Do I have a rapport and relationship with them? Or is it simply transactional and I'm going to tell you what to do and maybe listen to you and maybe not listen to you? And that's where the experience realm really comes into play, that it's not just about that technical expertise, but it's also that empathy and compassion side to listen and say, I'm here to help you. What can I do for you?
Yeah. Let me ask you something, because I know that you also go to a lot of customer experience events. What sort of challenges do you face in the healthcare industry specifically, being that it's so highly regulated?
Yeah, so probably the biggest thing that we faced is the ability to share data and share data in a way that is very easy to share that data. So, depending where you go, yes, that data is mine as the patient, but it's under the auspices of the institution I'm being seen at.
Right.
And I have to go through the efforts to get that data, if I want to go somewhere else, transitioned over. And healthcare is about a story. It's not just one episode. We grow over time. Things happen to us, and there's a progression to that. So it's bigger than regulations. We just don't have a good mechanism right now to share data about both the experiences and the clinical care of patients. It's there, but it's complicated.
When it comes to analyzing patients' experiences and their decisions to choose one healthcare provider or not, you and I have talked about this before, Brian. I strongly believe that there are all these elements of human behavior that help form that decision, drivers, right, that actually play in people's minds and help them make the decision. There are a lot of different elements that come into play.
Yeah.
So, there are a couple traditional ones that we talk about when we're discussing customer experience. But what do you feel in your experience are some of the strongest drivers of patient experience, of a positive patient experience or a negative one?
Yeah.
So, you talked a little bit about trust, right? Trust is probably a huge driver. It's definitely something that impacts customers' experience or patients' experience with their healthcare provider. What are some other ones that we can kind of outline?
Yeah. Well, trust, is something that you have to build with time. That some people it's there, others you have to grow it. And how do you grow that trust? And I think those are where some of the behaviors that come into play in the healthcare space. And of course, this is unique to the various systems. So I'm going to speak now just at the outpatient or the provider level. What are driving people? am I being listened to? Are the providers, the nurses, the staff, are they valuing me as a part of the care team and listening to the story I'm telling and what my wants and needs are and meeting me where I'm at? Or is it just, yeah, I know what this is, do this.
Mm-hmm.
Take my advice, go do it. And I think that's where we in healthcare have had to learn, going from this kind of paternalistic system of we know what's best to first asking the question, tell us about you, tell us what your problem is and how can we help you? And then molding in so the patient feels like they're listened to and they're communicated with. So communication and listening are two huge, huge factors. And I would say that's across any part of the healthcare system, not just the outpatient space.
Mm-hmm. How much do facilities play into a good experience or a bad experience?
It's interesting. There's differing studies out there on this, and I'm going to go through my lens on what I hear from patients.
Mm-hmm.
Certainly, the comfortability of a facility can have an effect, but the big but on that is they're willing to have maybe substandard facilities if the expertise of what they're seeing is going to help them get better.
Mm-hmm.
So if I have a problem and I want to go to the best, I'm willing to maybe let go of the 1950s feel of the place, or it's maybe a little run down, if I know the expertise is going to help me get better. But that being said, a lot of conditions these days are more transactional. I need an update. I need my medicines filled. I need that. And that's where facilities do come into play. And from that perspective, it's really more where the facility's at.
Mm-hmm.
Is it convenient for me? Because, in metropolitan areas like here in Nashville, traffic is hard. It's difficult.
Yeah.
And, can I spend an hour of my day or 2 hours of my day fighting traffic to get to the doctor's office to be seen and then go back? Or do I want to go something really close that I know I can get in and out real quick? So we think of this. We think in terms of, is it locale now? Is it near? And of course, you want updated facilities as well.
Do you think? Well, I'm sure it does. But how much does wait time play in? Is that a big challenge that you guys face?
Yeah. Yes, and I think a lot of institutions and I hate it. We all hate it. We don't want to make our patients wait. Part of that is just the economics that the volume, what we're trying to see and take care of, exceeds the capacity of what we can do in a period of time. So we want to do as much as we can, but then that can get backlogged, right?
Yeah.
And what I find though is it's shifting a little bit, but by and large, we are willing to wait if we're kept informed,
mm-hmm.
which shows respect. It shows that it shows I respect your time, that you're a professional, you're busy, I'm busy too. And I'm going to keep you informed and let you make a decision. You know what? I can't wait any longer. I've got to get to this meeting, or I've got to get this, or I've got to go pick up the kids, or whatever's going on in life at that period of time. So, the things we talk about is really keeping patients informed about those delays. And we find that if we do that, people are willing, by and large, to wait. They know it's part of the equation. There's another part to that, and that's expectation setting. And I think this is a space in the healthcare arena that we can always get better at. It's setting the right expectations. And I will frequently reference, people can get sideways with me on this when I reference the restaurant industry because it's not like healthcare. But what restaurant industries have figured out very well is how to manage expectations, right? How often do you go to a restaurant and they say it's going to be 30 minutes and it's actually 45 minutes these days?
Mm-hmm.
My experience, not very often.
They do the opposite, right?
It's actually the opposite. They're telling you 30, but it's actually 15. Yeah. So all of a sudden, you're thinking, I'm going to sit here for 30. I made a decision. And then, surprise, guess what? We're ready to take you back. And it's 15 minutes. That's something we have not quite embraced yet in the healthcare space of delivering on that expectation setting where we set it low and deliver high, right? Yeah. Did I say that correct? Yeah.
Yeah. In the past weeks, we've seen drastic fluctuations in customer buying patterns and sentiment. Now, more than ever, in this time of need, it's important to monitor and track how your customers perceive your processes and experiences. If you'd like to know more about how Worthix can help your company stay ahead of customer expectations, reach out for a demo at worthix.com. This is so fascinating for me because it really goes along with what I always talk about, which is that It's all about how those drivers weigh out for the customer at that moment. So, if you have a lot of trust in your healthcare providers, the other drivers will be less relevant or less important or have less impact on the decision.
Right.
Whereas, I always talk about this with restaurants. We go back to restaurants once again, but so me personally, I will go to a place that has really good food. Okay. And if the service is crappy, I mean, it's really hard for me to go back to that place.
It is, isn't it?
Unless, like you said, my expectations were really low. So if I was, and that reminds me of, I don't know if you were a fan of Seinfeld back in the day.
I was.
But it reminds me of the soup Nazi.
Oh, yeah.
You go and get that soup, and the soup is so amazing that you put up with this horrible, horrible service because you want that soup so much, But if the food is just normal, you will definitely not put up with bad service.
Yeah.
So everything depends on how each situation plays out with those decision drivers.
Absolutely.
And the exact same thing is happening in healthcare. But changing the subject really quick, we know for a fact that, customer experience has a lot to do with employees.
Yeah.
And employee experience and how employees not only interact with the company, but how empowered they feel to actually help the customers. I'm pretty sure that this is a big factor when it comes to PX as well.
Oh, it's at the crux of it. It's right. It is the crossroads of it. I mean, I will tell people we are in the business. Our product in healthcare is managing human capital. That's our product. Think about it. Most everything we deliver relies upon humans to deliver that. And anytime you put humans in an equation, it can become very complex real quick.
Yeah.
And there's so many individual factors that play into that. So when you rely on humans to deliver that service, they have to feel like they're part of something bigger than them, that they belong to it, right? And that they're making a difference, that their contributions are making a difference. And what other industry can say other than healthcare that you are making a difference? You are truly making a difference in someone's lives. And I tell people, even if you're not in direct patient care in healthcare and you work in, IT or billing or any back end functions, you're one removed. You're part of the team that is helping those direct care providers. So if you can make their job a little easier, you can guarantee that it's affecting a patient somewhere along the line. But that engagement and that employee experience is so vital because we have issues right now in the healthcare space of burnout, of wellness. It's exhausting. You go home and you're tired and you got to get up the next day and you got to put yourself back in the frame of mind. I'm here to serve. I'm here to help people. But there's days where you just don't feel like it. And I don't know about you, but me, when I don't feel like it, I'm not on my A game.
Absolutely.
And I think others around it are going to feel that. So if I'm a direct care provider, I'm not having a good day, guess what? People are picking up on that. And it's not just the patients in the room. It's also the staff that work around, you work with, because it's a true team sport.
And you're so right that the level of human interaction in the healthcare industry is so strong because you can't really replace any of those roles with machines or chatbots or whatever.
Well, we're trying. I mean, there's a lot going on in that space. Yet to be seen if it actually can make a difference or not. But yes,
you'd have to have some pretty cool robots to do that. But it really is. Do you think that training is key when it comes to that? Because lots of times when you have exhaustion or people have bad days, but ultimately, if we can kind of default back to almost where you go into auto mode, if there's really solid training, I think that even in our worst days, I could be wrong here, I don't work in healthcare, but I think that even our worst days, if we can default to our training and it's really, really strong and always striving to be just really, really human, I think that that's already helpful.
Yeah. So I think of that a little differently. Yes, training is key. And, that experience that we have of see one doing one and you grow confidence in it, you can go back on that and that really helps you. But when you think of interactions and you think of if I'm having a bad day, is my training really going to, if I go back and center myself on that, is that going to improve the next room I walk into? Well, maybe, But I would hypothesize what actually is going to make it more so is the effect that people you work with around you have on that, the teams you work within. There's we expect people, and so you come in, you get all this clinical training and this tactical training, but we need to spend more time on the human side of it. We expect us just to naturally understand how to work in teams. But it's amazing the number of times when I talk to different teams, they don't even know each other. I mean, they know their name, but they don't know about them personally. And here I am relying on this person to do their job and jump in. If you think of the most effective teams, it's I have your back and you have my back, right?
Yeah. Yeah.
And the most effective teams in healthcare, those are the teams that have that, but not every team does. So how can training is a part of that, but there's also focused time that needs to be given on developing teams in the healthcare space, because it is, like I said earlier, it is a true team sport.
That's awesome. Another question, just kind of following up on that same topic. How often do you see that healthcare providers, since they're so close to life and death, and I imagine it's really difficult, it really takes an emotional toll to be so involved in such a vulnerable moment of life, really. Does it happen more often than not that people get cold or get used to it and seem to deal with it in a more matter-of-fact way than it should?
So the term we use for this is desensitization. They become desensitized because they see it so frequently. And you have to remember that healthcare is broad, and there's a lot more living than there is dying, thank God. So there's a lot more wellness and curing going on than there are, unfortunately, people passing away. But it does happen. That's life, right? But that passing can be narrowed down to different segments, within the healthcare system. And those teams, that's where they have to rely upon the true essence of the people they work with, the social support, emotional support around them, be it at home or in the workplace, so they don't become too desensitized to it, that they have time to decompress and get away. So emergency departments, surgical areas, ICUs, cancer, palliative care, those are the ones that come to my mind, where those teams are dealing with it more frequently, where they see the really unfortunate part of human nature, someone passing on.
Yeah.
And can they become a little desensitized? Yeah, maybe. But I think that they are professionals and they come to do their job and they come to do it very well. What fills their cup is that knowing that the next patient in the room still needs their help and their outcome is going to be good, and they have a team that they can rely upon to help them.
Yeah.
Make sense?
Yeah, absolutely. And it's great. Now, moving into the technical aspect, which is the part where you need to actually look at numbers, look at metrics, try to find new ways, map the patient journey, be creative in how to improve that patient experience. What are you doing? And what is the organization that you work for? How are you working together to improve patient experience?
Yeah. Well, the first thing I'll say, and this is broad health, we have no shortage of data. We have plenty of data. We have more data than sometimes we know what to do with. So our insights can be very deep. The challenge we have is getting our arms around it, because they can be varied and they can come at so many different avenues and angles and inputs. So for me, it starts with narrowing down what is our goal. What is our common purpose in this? And in the patient experience, that is putting the patient first in a very just kind of matter-of-fact, pure way. The patient is first. So if you take that perspective and we're doing everything we can to help that patient, how does their experience translate to the other patients we see, and what can we learn from that? And this is where data gets complex, because every person's experience can be a little different. Their expectations can be a little different. So we're looking for patterns. We're looking for trends. We're looking over periods of time. We're benchmarking. Benchmarking's big. Comparison. Ego plays into that a little bit. But it's also to say, finger in the wind, how do we compare? Are we average? Are we better than average? Are we below average? And that gives us a sense. But to really do improvement efforts, you got to dig down in there and get down to the root of the patient level and really listen and hear the patient comments that we get, which we get thousands of them. And we're so lucky that patients are willing to give us their time to give us that feedback. and to use those comments to try to put together a picture of, is this experience wholly owned and wholly unique to this individual? Or is there circumstances of this patient's experience that are replicated across others? And then how can we use that to make improvements so the next patient walking through the door doesn't experience the same thing?
Mm-hmm.
And that could be on the system process side, and it could be on the human side, right? Because people are responding to both when they tell us about their experience.
What are you looking for? What sort of trends are you llooking for in the data?
Yeah.
Are there KPIs that are in play?
Yeah. So we measure top box score here at Vanderbilt,
Mm-hmm.
and in the consumer space. Some of the go-to metrics are likelihood to recommend, overall quality of care. We tend to steer away from that because our vantage point is that's one question, one response. And those questions are very powerful, don't get me wrong, but it's still one question, one response. If the experience of a patient is the sum of all interactions, then we need to take into account all of the questions that we're asking the patient feedback on. We take all the questions on our survey, we accumulate those to a top box score. How many times did we get that top box checked? And we get a score on that. And then we aggregate that over across all our service lines, and we ultimately land with one score. Now, that goes all the way up to the top, and then it comes back down because you got to redivide it out across the areas and start looking at, is this above average? Is it below average? How does it compare to their peers? Because every specialty is a little different in terms of comparison. There's not one broad comparison across the healthcare space. So I think the common purpose is so important, but then taking the data and translating that to a score that then can be divided out of what does this score mean? So we're getting a top box score of 70% on this. The 30% that's giving us not top box, our opportunity is in the space of facilities, is in the space of access, is in the space of, communication. And we ask specific questions on all those. And what I find is no two are alike. Every practice, every area is just a little different, a little unique in what's going on with them, what they do, how they do it. That it requires a lot of time and effort to figure it out. And then ownership. People have to look at the data and say, okay, I understand this. This is what my patients are saying. Is this unique, or is there a systemic problem here that I can help so it improves it for other patients walking through the door later? Is that it? Did I answer your question?
Yeah, you did. And one final question before we wrap up.
Yeah.
How big a role would you say experience plays when it comes to the strategic decisions made by not only your organization, but by the industry in today's day and age?
I think there's room. I think there's room for growth in there. Certainly, experience is in the equation. It is part of the conversation. It is not the only thing, though. And many institutions are also marrying experience and quality, so outcomes, which makes a lot of sense. We want quality outcomes as well. The patients expect quality. They come in expecting that they're going to get good clinical care. The experience side maybe is a little more wide open. But I think that in the healthcare space, we still have a lot of opportunity from the executive level on down of really understanding the effect the experience has on those outcomes. And there's more and more studies that are showing that, we can have good clinical outcomes, but if people don't feel listened to, they don't feel heard, are they walking away feeling as good as they could if they felt like they were in control and they were part of their team and that their care was 100% in their control? I would hypothesize no, that they would want more, right?
Yeah. Well, this has been a great discussion. It has been fascinating for me to hear from the inside, because I think this is the first time on this podcast that we have someone who practices this inside an organization, giving us so much insight on what's going on. So I wanted to thank you for coming on here today. And I wanted to ask you, what are some ways, do you speak? Do you write? Do you interact in this space? How can our listeners communicate with you or follow you or ask you questions if they have questions on this episode?
Absolutely. So I'm on LinkedIn, and obviously Brian Carlson from Vanderbilt University Medical Center. That's a great way to interact. I'm trying to publish more and more on there in the experience space. So there's some writing on there. Specific to the healthcare, I do tend to talk in the patient experience realms, conferences specifically for that. But I'm also trying to broaden and get out in the consumer space because there's so much we can learn from the consumer space. Just like I think the consumer space can learn from patient space, from healthcare space.
Yeah.
And I think that's my impression as a consumer is so much is going digital and non-interaction, healthcare is still very much about that interaction. And I think that pendulum is going to continue to swing over time, and the consumer space is going to have to come back around to those human interactions, that sometimes you just want to talk to someone. Sometimes you just want to feel like you're being listened to. And I think that's where we can help and learn and educate the consumer space from the patient space.
That's great. Brian Carlson, thank you so much.
So I have one question for you. So you listen to all sorts of consumers talk. Listening to this, what advice would you have for us in the healthcare space?
You know what? I from what I hear, from what I heard you talk about today, I think that if other people in the industry think like you and have access to the same tools and information that you have, I think that it's setting a really good precedent, or setting a really good track for the entire industry. Because if I think the healthcare industry as a whole listened more, paid a little bit more attention, valued that human connection a little bit more, gave more focus to these smaller details that you've been discussing for the past 20 minutes.
Yeah.
I think that would improve, at least my experience first-handedly, that would improve immensely. And I definitely by far always prefer going to either a doctor's office or a hospital or any sort of healthcare facility where I feel respected as a human being, where I feel valued, and where I trust in those healthcare providers to do the very best thing for my health and to look after me.
Yeah.
So I don't really have anything to add to everything that you've said, other than keep doing it, keep building it, give it more space, listen more, grow these projects,
discuss it,
talk about it, listen to your patients.
Employee engagement, all of that stuff. Absolutely.
Yeah.
Amen.
Create a patient-centric culture in healthcare.
It's there. It is there. The patient is first, especially at the physician level. So
that's great.
Thank you so much. It's been a great conversation.
Thank you. I really appreciate this. Awesome. Thank you for joining us on one more episode of Voices of CX podcast. This podcast is hosted and produced by Mary Drumond, edited and co-produced by Steve Barry. Voices of CX is brought to you by Worthix. Keep up with the speed of change at worthix.com.